Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune City, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. And today's lecture is related with the Roganidan Vikruti Vijnana subject for sometimes with the second year or the third year BMS students. And today I would like to start with the paper 2 because some topics from the paper 1 we have covered. But paper 2 is basically related with the different various types of the diseases. Diseases according to the Srotasa. We have the n number of channels in our body which are called as a Srotasa in Ayurveda. The different micro and macro channels. For example, it can be compared with the modern system. Like they have the digestive system, we have the Anna Vaha Srotasa. They have the respiratory system, we have the Prana Vaha Srotasa. So sometime comparison we can do, but most important are the 13 Srotasas. This is a type of revision. Sravanat Srotansi. In the Srotas, there are 4 important functions takes place. Utpatti, Parinamana, Vahana and Utsarjana. Utpatti means the generation of that particular bhava padartha, metabolic process, Utpatti. Parinamana is also transformation process with the help of Jatragni and Dhatvagni. Vahana, transportation of the Poshaka Ansha. And Utpatti, Parinamana, Vahana and Utsarjana, removing of the waste product. So these are the important function of Srutasas. Today, I am going to start with Raktavaha Srotas Vyadhi. Actually, in Rasavaha Srotas, most important Vyadhi is a Jvara. But I was thinking that in the Charaka Uttarardha lecture, Charaka Samhita Chikitsa Sthan, Professor Deshpande is discussing, he has completed the Rasayana chapter, Vajikarana chapter, YouTube upload videos are there. Now I am going to start in this coming Sunday the Jvara Chikitsa. That's why I was thinking here in Roganidan we can take it afterwards. That's why I have started with the Raktavaha Srotasa. And you know very well, Mula Sthana of Raktavaha Srotasa, it's all related with the blood. Mula Sthana, Yakrut and Pliha. Yakrut is a liver and Pliha is a spleen. So these are the 2 important organs with relation to the blood. Because there are many things which are helping for the manufacturing of blood, that is erythropoiesis. Although I know RBCs and WBCs and platelets are created in the, bone marrow. Sarakta med, according to Ayurveda. Yes, I know that. But in liver, in the intrauterine life, the manufacturing process is taking in the liver. And afterwards, for example, copper, for example, iron, for example, vitamin B12, the proteins, these factors which are essential for the erythropoiesis, actually the Yakrut is helping for all types of metabolic process. Protein metabolism, carbohydrate metabolism, fat metabolism, biggest factory, biggest industry. So, Yakrut and the Rakta Dhatu are very closely related. Whenever your blood gets impurities, that impurities are destroyed, toxins are destroyed in the liver by the, which cells? Kupffer cell, Kupffer, okay? And as you know, naturally the spleen is the graveyard of RBC. When the RBCs finished their lifespan, 120 days, they are taken to the spleen and destroyed. So destruction of RBCs takes place in the pliha. But simultaneously, there are other organs are also connected with the Rakta Dhatu. For example, Hridaya, Rakta Vahini or the blood vessels. Also, there are the different things, temperature regulation, then color and complexion, which is expressed by the skin, So everything is one way or the other connected with Rakta Dhatu, because Rakta Dhatu Sancharana is through the Vyana Vayu and throughout the body. Throughout the body. Today we will discuss about two important diseases, Kamala, that is jaundice, and second disease that we will discuss is Raktapitta. Okay, so let us start to understand Kamala. First is a definition. Kamanlati iti Kamala. Very simple, you must remember. Kamanlati. What does that mean? It destroys your every desire. You don't want to eat. Anorexia, loss of appetite. You don't want to go to the college. The person don't want to go to office. Don't want to go to business. No want to eat, but there are all the his no, don't want to see that video. Don't want to see the mobile. Even some people who are smoking, they don't want to even smoke. Oh my God. Yes, that is true. Even the person loses the interest in the sex. Yes, yes, it's not mine. It's mentioned in the medical books. So that is Kamanlati. All your various desires about ahar and vihar, food and lifestyle, they are finished in the Kamala. That is why the Kamanlati iti Kamala. Line is very important. Now the types, mainly two types, Ruddhapatha Kamala, Ruddhapatha, obstructive type. And second is Bahupitta Kamala. Try to understand. Bahupitta, that is hemolytic jaundice. This is Ruddhapatha is a normal your jaundice like infective hepatitis because of the virus A is a Ruddhapatha Kamala. Even obstructive jaundice because of the bile stones, that is also included in the Ruddhapatha. So Ruddhapatha is our normal jaundice. When contaminated water we drink, ice we take, sugarcane juice in the rainy season, in the summer season, then the people are having epidemics of the jaundice, Kamala. So that is a Ruddhapatha. But when RBCs are broken down, too much, that is hemolytic jaundice. Hemolytic, try to understand. That jaundice is Bahupitta Kamala. So in Ruddhapatha, there are the two things that you can include or understand. And in the Bahupitta, that is a destruction of the RBCs. Hemolytic jaundice. Hemolytic. This is infective hepatitis and obstructive jaundice. Now, first, according to the Ayurvedic perspective, we know that it is because of the drinking of the bad water. But here, they have given by which your immunity becomes less. Immunity becomes less. See, Ruksha, Shita, Guruswadu, Vyayamair Veganigrahi. These are the causes mentioned by Charakshitthasthan, chapter number 16. So when the person is taking totally dry food, fast food, street food, street on the road, not eating regularly chapati, rice, milk, curry in-house, freshly cooked. No, that is Ruksha. Shita, stale food, not freshly cooked. Guru, fried with the oil. Vada pav, bhaji, that is Guru, heavy to digest. Madhura dravyas, too much fatty food, too much sweets, laddu, jalebi, sweets, mithai wale. Every time, many, that becomes the person becomes faulty metabolic process in the body. All this makes the faulty metabolism. Try to understand why it is creating the jaundice, because then your immunity will go down. Then ati vyayam, that is also one of the reasons to less your immunity. Vega nigraha, you know the 13 Vegas. Navegan dharayet, chapter in the Ashtanga Hridaya. Navegan dharayet, Vat, wind, mutra, shavatritchudam, nidra, kasa, shravashvas, jurumbashru, chardiretasam. If possible, try to remember these 13 Vegas. If the person wants to go urine, he's not going to urine. He want to go to the toilet, not going to the, want to eat, but no, busy, not eating. Although he is hungry, not drinking enough water, although he is thirsty. Although he is thirsty, he is not drinking water. Again, the problem is there that you are destroying your brain signals. Try to understand what is happening. Because your brain is giving the thirst center and the food center is in the hypothalamus. So that centers, the neurons, they get damaged because the person is not reacting to the stimulus. So nervous system is damaging. Try to understand because of this Vega Dharana. That is Ayurveda Vata problem. Vata Prakopa will take place. Second, Agantu causes. For example, in the obstructive jaundice or Raktapitta, there may be Pittashmari, like bile stones, krimi, any organisms, Granthi, like a tumor, Arbuda, Granthi, benign tumor, I am sorry, normal, and Arbuda is a malignancy. Then Vriddhi. So these are the different reasons mentioned for the as a causes of Kamala. What is the Samprapti? Kapha sammurchito vayuhu sthanat pittam kshipet bali. Charatikitthasthan, chapter 16. So I will mark for you. We are discussing pathogenesis. How that Kamala, according to Ayurveda, Kapha dosha becomes grathita, solidification. Actually, Kapha dosh is comparatively solid. Snigdaha shito gururmandaha trakshna sandra mrudusthiraha. Basically, it is a solid, but it is more become hard. It's like stone and ruksha. Because your dry food stuff, that snigdata goes away. There will be no softening, only hard, due to association with Vayu, and that this particular grathila, solidified, hard kapha will obstruct the pitta vaha sira, which is responsible because they are carrying the pachaka pitta, bile. They are carrying the bile. So bile cannot go into the intestine, into the duodenum. From yakrut and pittashaya. Pittashaya is a gallbladder, where the bile, liver is secreting bile and it is stored in the gallbladder. Vayu becomes sammurchita. The dosha, dushya, sammurchana janito vyadhi. So this Vayu becomes sammurchita due to the kapha, and vitiated Vayu makes the obstruction, it throwing away the pitta from its normal tract, and this pitta which being thrown out enters into the rasavaha, in the circulation, and causes the raktadushti and leads to the formation of Kamala Vyadhi. Okay? Vyadhi Udbhava, where it is generated by basic pathology, is in the gallbladder. Pittashaya. Then Adhisthana, where it is actually showing its effect on the Raktadhatu. And Sanchara, naturally, whole symptoms are seen in the whole body. Sanchar is Sarva Sharira. Next, what are the Rupa? Tilapishta Nivam Yastu Varchaha Srujati Kamali. This word is very important. I request you to write down this word because this is always asked in the oral examination. Where your stool is become little bit like a white color. Tilapishta Niva. Tila is a sesame. When the sesame is grinded in the machine, whatever the powder is coming out is a little bit gray in color. And that type of because normal color will go away because there is no pitta. So this tila pishta nibha. Nibha means similar. Like a tila pishta. Tila is a sesame. Seeds. Sesame seeds. Okay. So Kleshmana Ruddha Margam. Another important word is the Ruddha. Obstruction is there. Why this is happening? Ruksha Shita Guruswadu Vyayamair Veganigrahi. These are the causes. Kapha Sammurchito Vayuhu Sthana Pittam Kshibet Bali. What will happen? Haridra, yellow color. The icterus. It is called as icterus, means yellow color. To the eyes, to the nails, to the urine. So Haridra Netra here. Sclera. Sclera is white. It becomes yellow. Very important word. This word is very important and easy to understand. Haridra Netra, Haridra Mutra, Haridra Tvaka. Very rarely skin becomes the yellow color. But basically nails, which is also part of the skin, then Mutra, urine, That is called as a high colored urine in the modern language. But your stool, varcha is a stool. It becomes shveta, like white. Nara, human being. In addition to that, there are some symptoms because of the damage of the liver cells. For example, atopa will be there, the gas will be there, bulging of the abdomen, vishtambha, constipation, guruna hrudayenacha. Here, the chest will become heavy because of the gas in the stomach. Daurbalya, very, very weakness. Alpa agni, cannot having appetite. Parshvarti, pain on the liver side. Hikka, pressure on the diaphragm. Hiccup. Shwasa, breathlessness. Aruchi. This is the most important symptom. Aruchi, loss of appetite, loss of hunger. Mild fever will be there. Kramen alpas anusajjet pitte shakha shamachi. This is the name of that particular Kamala. So here you can see same thing, that whatever I have mentioned, I think I should not read it because I have explained all these things to you. Okay. Now we will talk about Bahupitta Kamala. There the diet was more Kapha and Vata type, Guru, Ruksha, etc. But here more concerned with the Pitta dosha. What is the difference? That Ruddapatha Kamala that we have already seen is related with the Kapha and Vayu, but Bahupitta is related with the Pitta dosha. This is the difference. Okay. So Pitta Prakopak Ahar Vihar, very hot and spicy, pungent, then alcohol, most important, alcohol, drinking. As an Upadrava of Pandu, many times this is happening after the anemic condition. That anemia is like a hemolytic anemia. Viruses are responsible for this disease when it manifests independent. It is termed as infective hepatitis and is caused by the hepatitis virus. That means this comparison, some people get it over there for the Ruddapatha, or some people consider it as a part of this Bahupitta Kamala. This virus resides in the blood and can infect others via the blood transfusion. That is called as a, because this is not virus A, this is virus B. Again, don't get confused. This particular first part is related with our normal infective hepatitis because of the virus A. I request all my students to write down the basic things. Whenever we drink sugar cane juice with ice, and that ice is formed from the impure water, contaminated water, that virus enters in our body. That virus is virus A. 3 weeks rest is enough. No specific treatment. But here what we are talking about, second one, this is virus B. Remember the difference. This is not routine. Virus B occurs just like your AIDS or HIV. Yes, that is hepatitis B. Hepatitis B, B virus is very dangerous because liver is totally damaged. It is not cured easily. First, virus A, very easy. Virus B, not easy. Patient can get into the liver cirrhosis, then maybe ascites, then maybe liver cancer. Yes, this is possible with virus B. Write down. That is called as a serum jaundice. Please write down. SERUM, serum jaundice. Serum jaundice. Why? Because whenever infusion IV, you give the blood, contaminated blood can pass that virus B. If you make any person intercourse with the prostitute or sex worker, Vesha, and if she has the hepatitis B, this person will get the hepatitis B. Are you getting? Just like HIV. If the pregnant lady has having with B virus, hepatitis B, child will also get B virus. So same 3 things which are there like HIV, similar hepatitis B is very serious. Okay, and that is compared with the Bahupitta Kamala. Pandurogi tu yotyartham pittalani nishevate. Pandurogi, basic thing is anemic condition because of the hemolysis. If that person is eating still pitta prakopak ahar, chili, spices, very hot. Kolhapur rassa, tamda rassa, non-veg, very, very, very irritating. Huh? Pungent, salty, and sour. Pickles, lot of pickles, lot of chutneys. Huh? That is very dangerous. That will cause tasya pitta asrug mausam dadva. Pitta will disturb the rakta dhatu and also the maus dhatu. Very interesting. Pittam asruk mausam dadva rogaya kalpate. If the patient's already suffering from pandu anemia, do the excessive intake of pittakar ahar vihar, it leads to the, can you see here? I am reading this particular discussion, increase in tikshna and ushna guna. Try to understand. Tikshna and ushna guna of pitta, and further pitta prakopa will take place. Okay? Such vitiated pitta causes vidah of rakta dhatu and maus dhatu, leading to the bahu pitta kamala. Totally sampraptis are different. Huh? Don't forget, ruddha pitta kamala different, bahu pitta kamala different. Also, excessive hetu sevana, that means causes of ushna and tikshna guna, lead to the causation of bahu pitta kamala. Now, what are the symptoms? Rupa are the symptoms. Haridra, same, yellow color. But here you understand this word. Please write down this word. Bhusham, very much dark color, yellow color. Very dark. More dark than a Ruddhapatha Kamala. More dark. Bilirubin level more high. Because hemolytic bilirubin will form. Okay? Haridra, twak skin, nakha, anana, whole face, Raktapitta shakrit mutro, bheka varno hatendriyaha. Indriya will be having problem. Sensory and motor system, they will be little bit damaged. Dah, burning sensation. Vipak, daurbalya, weakness. Sadana, anga sadana, very debility. Aruchi, do both. They here and there. Aruchi is there. Karshitaha, the person will lose weight. Person will start losing weight. Kamala bahupitta esham post shaka shreyamata. Yellow discoloration of the eyes, nails, skin and urine. Yellow color darkens and resemble like a turmeric yellow. Severity of the disease increases. Bilirubin starts increasing. However, the skin appears lusterless, like the skin of a toad seen in the monsoon. Similar type, very dry, a toad skin. It is called as a toad skin. Then lakshanas like a jvara, mild fever, daha, burning sensation, avipak, indigestion, daurbalya, weakness, angasad, body ache, aruchi, loss of appetite. Okay? Sadhya, sadhyat, prognosis. Please write down the word prognosis. Prognosis. Whether the disease is under control or not controlled. When there is a reddish discoloration of eyes, too much congestion, blood vessels are fragile, capillaries are lose their tone and they can break up at some places, then reddish discoloration, coppery red color of the face, stools, vomit and urine is seen. Because the RBCs are broken down. That's why this is coppery red is because of the RBC destruction. Lakshanas like dah, aruchi, trishna, anah, tandra, murcha, giddiness, and moh, delirium, confusion, drowsiness, and step by step unconscious. Disease is said to become asadhya if lakshanas like a jvara, fever, high fever will be there. Because lot of chances of super added infections. Immunities become less. So any infection, any bacterial infection will attack and high fever will be there. Then shula, severe pain will be there. Shotha, sometimes edema will come. Daha and loss of consciousness, that become emperor. So it is very serious, going to the serious. So doctor should give the explanation to the patient, relative that we are trying our level best, but we are not sure. Something like that. Okay. Then next is a Kumbha Kamala. Just a moment. Kumbha Kamala. Can you see here? What is that Kumbha Kamala? SAQ may be asked. Kumbha Kamala. Kalantarat. After some days, Kharibhuta Krichra Syat Kumbha Kamala. More dryness will be there, and that particular Kamala of longer duration and more severe is called as a Kumbha Kamala. What is happening? Krishna, Pita, Shakrit Mutro, Bhusham. Very much. Bhrusha means very much. Shunashcha Manavaha. When the Kumbha Kamala becomes severe and Koshtashrayi, Lakshana becomes stable, then it is known as a Kumbha Kamala. The disease, like as a Avastha of Kamala, is a one stage of Kamala. Stools, urine become dark yellow and tend to blackish later on. Eyes become deep yellow, joint ache will be starts, and edema occurs on the whole body. Okay. Another some disease is explained, which is called as a Panaki. So all these questions can be asked in the oral also. What is Kumbha Kamala? What is Panaki? What is Halimaka? Kumbha Kamala, Panaki, Halimaka are concerned with the jaundice. Kumbha Kamala, Panaki and Halimaka are related with the Kamala Vyadhi or the jaundice. What is there? Panaki, Santapo Bhinnavarchascha, Bahirantascha Pitata. Everywhere yellow color will be there. Panduta Netryoryasya Panaki Lakshanam Vadet. But this is not from Charak. This is from Vangasena. The entire body is having color yellow, internally as well as externally. Eyes appear yellowish white. Stools are scattered and not bounded. Sushruta has named this as a Panaki. Panaki word is used by Vangasena. But the same condition explained by Sushrut is a Panaki. Don't worry about it. He has given his own style. Okay. Now Halimaka. What is Halimaka? We will see about Halimaka. Here, can you see? Yadatu Pandor Varnaha Syat Harita Shava Pitaka Bala Utsaha Kshaya Tandra Mandagnitvam Mrudujwaraha Strishu Aharsho Angamardaha Shvasa Trishna Aruchi Brahmaha Halimakam Tadatasya Vidyat Anilapittataha. I think here is very interesting thing. In Ruddakatha Kamala, do you remember? Vata Kapha. Bahupitta Kamala, Pitta. But here in Halimaka, Vata Pitta. Write down this point, Vata Pitta. First, I will explain again. Ruddapatha, first one. Ruddapatha, infective hepatitis A, Vata Kapha. Then Bahupitta, hepatitis B, serum jaundice, hemolytic jaundice. What is that? Pitta, Prakopa. And here in Halimaka, Vata and Pitta. First Vata Kapha, then Pitta, and third is Vata Pitta. Halimaka can be classified under the Pandu or Kamala Vyadhi. Oja Vikriti is very severe. Always remember, Vata and Pitta are both degeneration making doshas. They are always making our body weak. Because Vata is a dry, Pitta is a heat. So if both comes together, always there is a more damage. Autoimmune diseases, all these things are related with Vata Pitta. Early aging, fast degeneration, always with the Vata Pitta. Remember, there is no Kapha. Kapha is always nutrition, stability, growth, but here Vata Pitta. So Ojakshay is there and Vata Pitta dosha are predominant in Samprapti. So can you see Strishu Aharsho? He is not interested to perform sex. Strishu Aharsho. Very much pain in the body, Angamarda. Breathlessness. Immunity is less. No Oja. This is Halimaka. Okay. Now we will start with the another disease, that is a Raktapitta. So kindly make an end line. We have completed first important disease from the Rakta Vahasrotas. So write down very important disease. Kamala is finished. Just I can give one very interesting story in short, 2 or 3 minutes. I personally has made the research on infective hepatitis A virus, regular virus, regular jaundice. You see, in the modern medicine, they don't have any specific treatment. They don't have specific treatment. They only 3-week rest, if necessary, B complex, vitamin C, and IV fluids if there is more vomiting. Myself and Dr. Srikant Wagh, who is MBBS, then MBBS, first BMS, sorry, sir, then MBBS, then MD. We both were working, rather, he was my teacher in Nanal Hospital, Pune, and we together made one interesting research. So you write down, very interesting, hepatitis A virus, Arogyavardhini tablet, Arogyavardhini, fantastic. 3 tablet morning, 3 tablet afternoon, 3 tablet evening. Arogyavardhini tablet plus Kumari Asava number 1. Kumari Asava number 1, 4 teaspoon of medicine, 4 teaspoon of water with Arogyavardhini 3 times. And we have proved that within 1 week, the patient gets hungry, and also bilirubin level drops down. Within week, fantastic. We have compared the modern and Ayurveda, and Ayurveda has a better results. So if you find any patient, any time in your life, take it from me, Dr. Deshpande. Hepatitis A, 2 best medicines I have given you. Arogyavardhini, but dose is more. Not only 1 tablet morning, evening. No. 3 tablet more adult. Morning, afternoon, evening with Kumari Asava number 1. Chalo, let us start with Raktapitta. The name itself, there is a problem with the Pitta dosha and there is a problem with the Rakta dhatu. So what is the dosha dushya samurchana? Pitta is attacking on Rakta. Both are dushya samurchana has been generated and disease has started. In Raktapitta Vyadhi, you can consider many bleeding disorders, bleeding problems. For example, Urdhvaga Raktapitta, Adhoga Raktapitta, Tiryaka Raktapitta. When there is a bleeding from the nose in the summer, May month, hot sun, bleeding from the nose. Epistaxis. Tuberculosis, bleeding from the cough. Hemoptysis. अल्सर, पेट में अल्सर है, पेप्टिक अल्सर, वोमिटिंग, ब्लड, हेमेटमेसिस, हेमोप्टिसिस, this is epistaxis, hematemesis. Now we will think of downward. I think few days back I have discussed this thing. That is per rectal bleeding because of the piles. With the urine because of the stone, hematuria. In the ladies, lot of bleeding with the menses, menorrhagia. So this is all, even idiopathic thrombocytopenic purpura. Here the bleeding in the capillaries, in the skin, Tiryaka Raktapitta. ITP, idiopathic thrombocytopenic purpura. Purpura and ecchymosis, big blackish, bluish spots indicating bleeding under the skin with the capillaries. Okay, so this is related with the Raktapitta. So most important is a Pitta Prakopaka Ahara Vihara, very dangerous. So whenever your relatives or the friends, if they are eating too much spicy, always warn them. That can affect their bleeding time and clotting time. Destruction of the RBCs, platelets will be problematic. What is the normal count of platelet? Write down. Normal count of platelet. 2.5 to 4.5 lakh, LAKH. 2.5 to 4.5 lakh per cubic mm. Platelet count. If this count comes below 50,000, OMG, oh my God, in the dengue, that is dengue hemorrhagica. Oh, very dangerous. Admit the patient. If it is below 50,000, normally it should be in lakh. But I assure in Ayurveda Academy, we treat such type of the cases. Even in the Ayurvedic hospital, we have the different connections with the different of my colleagues and friends, students also. So we can give the treatment for idiopathic thrombocytopenic purpura, ITP. If you are taking a lot of blood transfusion, your platelet count is not increasing, please WhatsApp to Ayurveda Academy 922681060, given in the description. Okay, so we will talk about Raktapitta. First is a definition. Pitta dosha is a most important bioenergy in this Vyadhi. Vyadhi means disease. Vitiated Pitta combines with the Rakta and causes the Rakta Dushti. This will lead to the Pitta getting Gandha and red color of the Rakta. Pitta dosha will get the smell like a blood. Pitta dosha will get the red color. Normally it is yellow. Because of the Rakta Dushti, it will get mixing. Rakta and Pitta mixing. Hence, this disease is known as Raktapitta. Sanyogat. Sanyog means union. Dushanat. Tattu. Samanyat Gandhavarnayoho. Raktasya Pittam Akyatam. Raktapittam Manishibi. Sir, what is this Manishi? Manishi? Manishi means intelligent people. Manishi means intelligent people. Vidwan Vyakti. The shlok is in the Charak Chikitsastan, chapter number 4. The three terms are there. Sanyoga. Can you see? Now I will make the cursor ahead so you can read those lines. Concentrate here. Sanyoga is there. Dushana is there. And Samanyatva is there. So write down these three words. Sanyoga, Dushti and Samanyatva. Described by Chakrapani in the following three definitions of Raktapitta. Raktayuktam Pittam. Raktayuktam Pittam iti Raktapittam. That is Sanyoga, mixing. Then Rakte Dushye Pittam. Rakta is Dushit because of the Pitta. Raktavat Pittam. Very similar to the Rakta. Getting the smell, getting the color of the Rakta to the Pitta. So three words are important. Sanyoga, Dushana and Samanya. The Vyadhi is from Abhyantara Marga, that is inside of the body. You know that first is a Koshtashrita Vyadhi, Shakashrita Vyadhi and Majjashrita Vyadhi. These are the three Margas. This is Daruna, serious, and Shigrakari. Instantaneous, the bleeding will start without any warning. There are three types. For example, these are the prakar or the types. First, four types according to the predominance of dosha. Vataja Raktapitta, Pittaja Raktapitta, Kaphaja Raktapitta. And when all the three doshas are there, Sannipatik, very serious. Always Sannipatik word indicates seriousness of the disease. Never forget. Prognosis is bad for Sannipatik. Always, or any disease. According to the Gati, Urdhvaga Raktapitta, bleeding from the upward part. Adhoga Raktapitta, bleeding from the lower part of your body. And Vimargaga, Tiryak, in the skin. Tiryaka Raktapitta. Okay. Now we will discuss about the causes of the Raktapitta. These are very important because I request whenever you get any patient of ITP, or any Cooley's anemia, hemolytic anemia, warn them that this type of the food and lifestyle should be avoided. The shloka is not easy to remember. Forget. Immediately forget. Okay. So barley, too much ushna and tikshna, spicy food, simple, pungent spicy food, chili, sour, salty, chutney, pickles, Kolhapur Tamla Rasa, non-veg, red meat, okay, alcohol, all is Ushna and Tikshna. Curd, too much curd, sour buttermilk, pork, beef, this is red meat, radishes. I have picked up only important, which is underlined, think over that only. Forget about all other things. Mustard, garlic, drumstick, This can cause Vata Pitta Prakop and leading to the Rakta Dushti. Vitiated Pitta having the Kapha dosha Anubandha. Anubandha means secondary. It's not a primary. Primary is a Pitta, but little Kapha. Then it moves in the Amashaya, in the intestine, that stomach, and comes out in the Urdhva Srotasa, like Nasa, Mukha, etc. Okay, like nose, ears, or mouth. If vitiated pitta is having vata dosha anubandha, then it moves the pakvasha, the lower tract. Then it will go down. This is a pathogenesis, samprapti. Okay, and comes out with the adho srotasa, that is anus, per rectal bleeding because of the piles, vagina, that is menorrhagia, menstrual cycle is more, or penis, that is hematuria. Okay, if all the three doshas are disturbed, then severe srotorodha occurs, obstructions everywhere, and rakta becomes tiryak. There is no upward chance, there is no downward chance. They go into the capillaries on the skin, and dushita rakta comes out of the skin. Then there is a purpural patches, ecchymosis patches, and comes out of the veins and collects underneath the skin. So Shrut Uttar Tantra 45/6, this particular reference is there. Both Ranjaka and Pachak Pitta are involved in Samanya Samprap. You know that Ranjaka Pitta is in Amashaya and Pachaka Pitta is in the intestines. Okay. Further, we will go for the next discussion. Okay. According to the modern medicine, hemorrhagic disorders may be correlated with Lakshana of Raktapitta Vyadi. So, any hemorrhagic diseases. Pathology, according to modern science, inadequacy, that means platelet count is always low. Then lack of clotting factors. You know the 13 clotting factors. You remember the first year BMS physiology subject? There we have discussed these 13 clotting factors. Okay. Thinning of the capillary walls. Then the conditions like hemophilia, this is the name of the disease, purpura, idiopathic thrombocytopenic purpura, and leukemia is a blood cancer. Charak Sutra Sthan 24 chapter, given the various causes of Raktadushti, like for example, Ati Drava Padartha, Ati Snigdha Padartha, fatty substances, Ati Guru Sevana, that becomes the metabolic disturbances. Liver will be problematic. Okay. Divaswap, sleeping in the daytime, that can also disturb your circadian rhythm. Biological clock is getting disturbed and your immunity becomes less. Then Atapa and Agni Sevan. Whenever the person has a business or the job, moving all the time in the sun, that is very dangerous. Moving or having the job near to the furnace, like brick factories, chemical factories. There are even the cook who is doing the different hotels, the kitchen, who is handling the kitchen responsibility. The cooks, they are having Agni Sevana, not doing the Rakta Mokshana when indicated. They know that they are suffering from various skin diseases, but they are not purifying their body. To purify the blood, we have the Rakta Mokshana treatment. You know that. Vamana, Virechana, Basti, Rakta Mokshana, and Nasya. Indulging in Ushna, Tikshna, hot and penetrating, Katu, Panjanta, Vidahi, Drava, Amla, and Kshara Guna, alkalis, that can cause this Pitta Prakopa. Both Rakta and Pitta get vitiated, and their respective Nidan because of the causes that I have already mentioned. Vitiated Pitta enters into the Rakta Vasrotas and vitiate the Rakta Dhatu. Rakta Dushti will happen. Next. Pitta and Rakta vitiate each other. Sanyoga Dushana Tattu. Vitiated Pitta circulates all over the body. So Adhishthana, where basically the disease process has started, that is Yakrit and Pliha. Srotasa, which is Srotas, Raktava Srotas, and Vyadhisthana is Bahya Srotasa, which are going out of the body. This is nose, for example, rectal, for example, urethra, for example. This is Bahya Srotasa, not Antargata, not internal. Now we will talk about the Purva Rupa, that is warning signals, that is a prodromal symptoms. Can you see? Purva Rupa, Nidan Pancha Panchak. What is that? Shiro Gurutva, heaviness in the head. Aruchi, not want to eat, not having the desire to eat. Shitecha, because a lot of heat is inside. So the person wants that I should be cold water, cold drinks. I want the ice. I want the AC, air conditioning. That is Shita Icha. Dhumako Amlakaha, too much water brush. And like the vapors are coming from the mouth and the nose and the ears, such a heat will be inside. Chardi will be there, vomiting. Huh? Chardi, Vaibhatsya. Whenever you see the ugly thing, you will get immediately vomiting. Kasaha, cough, Shwas, breathlessness, Brahma, because anemia will also develop. Brahma, giddiness, and Klama. Klama is a tiredness without exercise. Speciality. Klama is a not Daurbalya. Klama is different, Daurbalya is different. When you do a lot of physical efforts, physical exertion, and then you are tired, that is weakness. But you are sitting whole day, but still you are feeling tired, that is called as a klama. Okay? Loha lohit matsyam gandha sattvam swarakshaya. Voice will be also deteriorate. Voice will become low and low because of the ojakshaya. Heaviness of the head, aruchi, desirous of the cold foods. I think I have just now explained you, but I will mark for you. Then sensation of hot vapors coming out of the mouth, acid reflux in the throat, excessive vomiting, brahma, giddiness, klama, I have mentioned, swarakshaya, hoarseness of voice, voice becomes less, yellowish, coppery red discoloration of the stools, urine, sweda, sweating, dreams along with the fiery flames in the purva rupa of Raktapitta. When you sleep, you get some dreams where you see the lot of fire. That indicates that too much heat is in your body, and that will come out in any way, any time. Okay, that is a warning signals. Now, what are the rupa? Rupa is the actual symptoms and signs. So here you can see. These are the rupa. Sandram sa Pandu. Pandu is anemia. Sasneha. Pichilam cha kafatmakam. Raktapittam kashayabham. Krishnam go mutra sannibham. Mechaka. Difficult. Forget. If you find shloka difficult, don't read it. Don't learn by heart. It is not compulsory. Few important shlokas you remember, others you forget. You remember the translation. Many of the Purva Rupa get manifested as a Rupa. They are converted to symptoms. Raktapitta, Rakta Pravrutti will be there. Mainly bleeding will start. Primary and important lakshan of all the symptoms. Bleeding is most important feature. Daurbalya, because anemic condition is there. Shwas, in anemic condition, you require more, what you can say, the oxygen. Because the RBCs are carrying the oxygen and they are less. So you make a more efforts to breathe more and get the oxygen inside. Okay. Then Kasa, Panduta, pale color, Jwara, mild fever because chances of viral infections, and Trishna, lot of thirst will be there. Rakta Pravrutti occurs through the ears, nose, basically the nose, that is epistaxis, eyes, then mouth in the Urdhva Raktapitta like hematemesis, I have already mentioned, hemoptysis, through the Mutra Marga, that is hematuria, Purisha, per rectal bleeding, and Yoni Marga, through vagina, through the skin pores in the Tiryaka Raktapitta and underneath the skin causing reddish, purplish, black patches on the skin. Remember this thing. Now we will talk about Upadrava. Can you see? Upadrava. Complications. Most is a Daurbalya, naturally. Anemic condition will give the weakness. Shwasa, breathlessness. Kasa, cough. Fever, infection chances. Daha, burning sensation. Then Murcha, giddiness. Vidaha, Raktapitta. Chest, there will be pain. Trishna, Rakta Pravrutti in the Koshtha, and Shiro Abhitab. Head will be little bit, what you can say, exhausted. Next is a Samprapti. If you can remember, it is very good. Pathogenesis. Try to remember. This is easy shloka. Tair hetu bihi samutklishtam. Because of the causes, samutklishtam pittam. Pitta prakop. Raktam apadyate. Raktam prapadyate. Tadyo nitvat prapannam cha vardhate tat pradushiyat. It will increase the quality and quantity of Rakta Dhatu in a pathological way, and it will also Dushit Rakta because of the Pitta. And Pitta is disturbed because of the Pitta Prakopak Ahar Vyar. So what is happening? Tasyoshmana Dravo Dhator Dhato Prasichyate Svidyatastena Samruddhi Bhuyastat Adigachati. If remember, okay. Not remember, that is also okay. Don't take tension. Pitta gets vitiated due to the causes that we have already discussed. Madhyapan, spicy food, red meat comes out of its sthana, Pitta will come out and reach the Mula sthana of Raktava Srotas, that is liver, leading to the Raktadushti. Due to the Abhishandi, Guru and Amaguna. These are the pathological properties of the Pitta dosha. As Pitta and Rakta have the Ashraya Shri Sambandha, Sammurchana takes place and transfer of Laghu, Visra, Sara and Dravaguna of Pitta that will be transferred to the Rakta. And Rakta property like Rakta color, Gandha and Varna will come to the Pitta. So there will be exchange, but that is not expected. That is pathological exchange of the properties of Rakta and Pitta. Exchange. So Rakta Pitta becomes the Dushita. This entity after Sammurchana of Rakta and Pitta, when comes in contact with all the dhatus in the body, what will happen? Heat of the Pitta causes Svedana. Perspiration, sweating, but Svedana is another way. Dhatu, they will be more, what you can say, their metabolism is unnecessarily, unwantedly stimulated. That is called as a Svedana at the Dhatu level. And loss of Dhatu. So Dhatus will be destroyed in the body. And the liquid from it mixes with the Rakta Dhatu. Clay will be more. Clay is like a liquid waste part from the tissue metabolism. It will mix with the Pitta, and again Pitta dosha will be problematic, will be Dushit. So you write down these steps, and if you have any difficulty, you can write down in the comment box or you can WhatsApp me. Okay. Next is, here you can see, Plihanam cha yakruchaiva tat adhisthaya vartate srotansi raktavahini tan mulani dehinam. See, what is happening in Raktapitta? Sushruta has put forth a different version. According to him, at first the Rasadhatu gets vitiated and then Pitta dosha get disturbed. He don't agree that directly Pitta is getting Prokopita. Sushrut say, first Rasadhatu is disturbing and then it will come to the Pitta dosha, it will also get disturbed. Okay, leading to the vitiation of Raktadhatu. He also says that Amashaya is the sthan of Urdhva Rakta Pitta, Pakvashaya is for the Adhoga Rakta Pitta, and Sammurchita Rakta gets Anubandha of Pitta dosha. Then Stivana is of foul smell. When one is spitting, it is foul smell. Veins becomes distended, capillaries, etc. Then there is a Anna Vidvesha. Patient will not like to eat something. Then Avipaka, digestion will not be proper, and loss of sexual power. These are the complications of Rakta Pitta Vyadhi. Next is Udarka. Udarka means residual changes. After the disease, some body elements, some body physiology is permanently damaged. That is called as Udarka. Yakrut and Plihavruddhi, hepatomegaly and splenomegaly. Permanent effect because of the Rakta Pitta. Then Pandu, anemic condition, and Daurbalya. Next is a part of Sadhya Sadhyatva, that is a prognosis. Urdhvaga Rakta Pitta is Sadhya. This is very interesting. Please write down. Urdhvaga Rakta Pitta is a Sadhya because in the Chikitsa, this is subject is Roganidan, but I am embodying Kaya Chikitsa. So I am telling you that Ayurveda is recommending Pratimargam cha Haranam. If possible, you write down. There is 1-2 minutes for us. The Chikitsa of Raktapitta, management of Raktapitta. Principle of the management of Raktapitta is this one, Pratimargam cha Haranam. So when the person is having bleeding from the upward tract, Urdhva Raktapitta, treatment should be Virechan. Write down. For Urdhva Raktapitta, treatment should be Virechan. For Adhoga Raktapitta, PR bleeding, hematuria, menorrhagia, Pratimarga, that means the treatment will be Vamana. For Adhoga Raktapitta, treatment will be Bomana. For Urdhva Raktapitta, treatment will be Virechana. Are you getting? Okay. So Urdhva Raktapitta is a sadhya, easy to cure. Adhoga Raktapitta is difficult to cure, yapya, and the patient has to follow some do's and don'ts. Pathya, then only the disease will be under control. Yapya means the disease can be under control if pathya is followed. Then, while Vimargaga, this Tiryaga Raktapitta, asadhya. It is not at all permanently cured. There is no permanently cure. We can control it, definitely, but no permanent cure is available for Tiryaga Raktapitta. I think we are nearly last point of Raktapitta is said to be sadhya, which is of single marga, recently occurring, slow oozing of the Rakta, not too much bleeding. Then Ekadoshaja, only Vataja or Pittaja or Kafaja. Then there should not be any Upadrava that occur in the Hemanta Rutu, which is cool, thanda, cool outside, December month, and Shishira Rutu, that is also cold. Whenever in the cold season you get bleeding, you understand it is very easy to cure. But if the bleeding is taking place in summer season, hot, Grishma Rutu, very difficult, very difficult. Samanya Vishesh Siddhant. Because Pitta dosh will be more Prakupita in Grishma Rutu. In Shishira Hemanta Rutu, Pitta dosha can be controlled by the nature and easy, simple treatment will be getting cured. Okay. Then, Rishta Lakshana, very interesting. Indriya Sthan, Charak Indriya Sthan, Rishta Lakshana, bad prognosis, bad prognosis. Tiryaga Raktapitta, in which Rakta oozes out from the skin pores, cloth, soiled with the oozing Rakta remains here. I will mark for you. We are at the last. That staining with the blood, that stain cannot be washed. That stain cannot be washed. Even after washing, that permanent blot will not go. Fast oozing of the blood, very fast, tremendous hemolysis, house-belling blood, and suffering from the serious vyadhi like Pandu, Jwara, Shotha. These all the total lakshanas are indicating the bad prognosis, Rishta Lakshana. So the doctor should make a counseling to the patient's relatives that we are trying our level best, but we are not having enough because the patient's morbidity is little bit problematic. So be prepared for anything. So this is in a soft spoken language. If necessary, you can tell that in the ICU patients, especially when you see the Rishta Lakshanas. Okay, don't make any tall claim. For the Raktapitta Vyadhi, I always insist, for the Urdhvaga Raktapitta, don't forget the Vasa medicine. Vasa plant is the best medicine for Urdhvaga Raktapitta. For any Raktapitta, I will recommend Gulkanda from the rose petals. Gulkanda, thanda, cool. Then I will recommend Pravala Pishti Vati. Right now, Pravala Pishti Vati. Best medicine. Kama Dudha tablet, antipitta. Chandra Kala Rasa. I am giving you the very interesting formulas. Chandra Kala Rasa, 2 tablets 3 times in a day. Then I am recommending Udumbaravale, very thanda, cool. Udumbaravale. For the ladies, I will recommend Ashoka Ghanavati or Ashoka Arishta. Basically, in Raktapitta, in spite of the Arishta, I will recommend the jam. I will recommend the single tablet, and especially for the bleeding, I will recommend the simple water or the rice water as a anupana. Are you getting my point? So my dear friends, today we have discussed very 2 interesting topics. Like one is a Raktapitta, bleeding disorders, hemorrhagic diseases, and another is a Kamala, that is infective hepatitis or the jaundice. Thank you very much. Tomorrow we are going to see the gynecological problems, Roga, and of course we are starting with the interesting topic that Vimshanti Yoni Vyapad. Although every student knows it, but many repetition and comparison with the modern is very essential in the Vimshanti Yoni Vyapad. We will make 4 lectures for the Vimshanti Yoni Vyapad. Thank you very much. Take care and see you soon in the next lecture.